topic of mine, and we're going to talk about are stroke patients aware? But before we go into stroke patients being aware, I want to talk about our own awareness and just a little different of a variation here. Let me just share this and go from there, and let's get right to it. Oh, right here. And this is awareness. So right here.
Out of order. Who the hell do you think you're talking to? I've been around, you know. There was a time I could see, and I have seen boys like these, younger than these, their arms torn out, their legs ripped off. But there is nothing like the sight of an amputated spirit. There is.
So that's really interesting. So when you say are stroke patients aware, so let's make sure that we talk about the difference between a spiritual stroke and a material stroke. Most people who are born on this earth have some sort of stroke that their spirit has that needs mending, and that's why hence we are on this earth, all of us included, unless you're of course a nitya siddha, which transcends every single religion and whatnot. But there are these special souls that are within each path that's found that actually are born in order to lead people so that they can actually enhance themselves spiritually. So this is the reason I'm mentioning this is because it's when I look at this question, are stroke patients aware? I know one patient who's had a stroke who's more aware than most, if not, yeah, most people that I've either read about or even known, and I actually have served him. So you have to be very careful about this question. Second, is on a more basic level. Let's go, of course, to Dr. Strange and our favorite neurosurgeon that has his spiritual awakening, quote unquote, but spiritual only to the point that he can do new stuff. Here you go. So this gets into anima, lagima, and all these different concepts that sort of come from the East, is your ability to travel, astral projection, all of these hokey type things that you can't really put your hands on, and actually sometimes quite useless if you get lost into it. And because it can just set you into a spiral and spiral and spiral. So now let's talk about stroke and get into the practical of visual agnosia. And this patient from this video talking about how he cannot see. So he can't, he's touching this book and doesn't really know what he's reading, but he's aware that it's there. And that's a visual agnosia. And then there's also these agnosias where you're not aware. And so this comes into not being able to see on that side and not knowing that that's there. And that's usually associated with the right parietal lobe. If you're a right-handed person, this is usually associated on the right side. So this is Dr. Paresh Malhotra. This is Dr. Paresh Malhotra, Paresh Malhotra, who's talking about this. And he's from sort of this, he's from the strokefoundation.com.
So people, objects, and sounds on one side tend to get ignored, and the patients who have it tend to be drawn to the other side. And this can extend to things like the food on the plate in front of them. So only food on this side, and then say they're finished, and then extend to.
So right here, this patient's only drawing one side of the flower, and that's basically it. So this is an awareness issue that's there. And this is, sometimes these are the tests that are there, that, you know, he's drawing on each side, of the, on the left side and the right side of the hand in this video.
Great. Okay, now open your eyes and tell me, what's the name of this? And this?
Let's go back. He'll put a key. There's a place where he...
In English. Number. Keep your eyes closed. I will write a number, and you tell me what's this number in English.
So you write a number, and then you tell the person the number of anesthesia, And you also do some stereotactic stuff where you put a key in the patient's hand or a pin, and the patient says, this is a key or a pin. Okay, right here.
Thank you. I place another object in the other hand while he's closing his eyes. What's this? Okay.
Great. So he can see. So there's awareness, but this is really where the patient either can't see or is not aware or has extinction that take place, and this is basically on the stroke scale. So this is something that we're worried about, and if TPA is to be given, we give it. But of course, the worst kind of awareness to not have is the spiritual kind of awareness, and people take lifetimes to learn and some people will never learn it, but that's okay, because at one time or another you'll be forced to learn it. So it's better to try to learn it. That's the thought process. Is awareness is definitely not there. So to answer this question, is are stroke patients aware? Well, after the actual stroke has happened, there's a deficit, but there are papers. If you interpret this question in a different way, you can say, okay, what does this question really mean? Are stroke patients aware of their stroke before it comes on? And the answer is yes. There are plenty of studies that also state that stroke patients also feel very uneasy the week before the stroke, and they have some sort of symptoms, not exactly TIAs, but they feel the sense of uneasiness that we can't really put our fingers on. And some papers talk about that. So it's quite an interesting topic as far as that, but that will be another video. All right. I hope you've enjoyed this video. Buy my book, Meditate or Die, KneeTie to Get High. It is 99 rupees in India, and it is $3 in America, and that can certainly help you in feeling happier and feel better.